If you or somebody you know struggles with any of the following symptoms: heartburn or a sensation of discomfort when you eat oily or fatty foods or fried foods, a chronic disease of any kind, weight loss issues, difficulty losing weight, or hormonal issues, this episode is for you.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts, or download each episode and listen to it on the go. Let's get started with today's episode.
All right, Healthy Reasoners, today is episode 31 of the Healthy Reasonings podcast. And I'm so excited to say that we're going to be tackling a topic today that I need to use to connect so many of the topics that will follow. So in episode 30, we spoke about prostate cancer, and we spoke about the connection between prostate cancer and the gallbladder. If you don't remember what that was like, but if you do, you'll remember that I made mention of the connection between the gallbladder and the prostate and the need for the gallbladder to be able to empty well. So today we're going to be talking a little bit about what is the gallbladder in the first place, how does it normally work, and what it is that we're trying to achieve when we want it to be healthier. Stick around and take a listen here. All right, so here we are looking at the gallbladder itself, and it's a tiny organ that is located on the back side of the liver. So it's kind of attached to the back of the liver, and it acts almost like a reservoir pump. The purpose of the gallbladder is to store and concentrate a certain amount of bile. And what bile does, bile is almost like the engine oil of the liver. If you could imagine the liver to be an engine, a car engine, or whatever kind of engine, then bile floats through millions of several little pipes called bile canaliculi, little pipes or ducts that are scattered throughout the liver. And what bile does is two things. One, bile is supposed to help with transferring of toxins from the bloodstream where they have been filtered through into the liver for cleaning, and then the liver packages them neatly and prepares them for transport into the bile where they float along out, and then they're supposed to empty. So here's the liver here sending out its bile via this large duct, and then it comes out and empties here into there's a fancy name, ampulla vata, that's in the small intestine. And the aim is that one of the functions of bile is it's supposed to be able to help to transport those toxins that the liver has packaged neatly out into the intestines. And then the aim is that they would ideally go onwards and out into the toilet. So one aspect of what bile does is it's supposed to be used for detoxification of the body. It helps with detoxification for toxins that can be excreted or gotten rid of in that way. They go out in bile. The tricky thing is that bile also has another purpose or function, and that is to help to digest certain types of foods. To digest certain types of foods, we need bile. Bile does something called almost what we want to call it is emulsification. What it does is it helps to break down the fats. All right, so we're going to talk about mainly fats today. So it helps to break down fats. And as a result of that, when bile is released in response to a certain type of food being present in the bowels or the stomach, then what happens is you have a good amount of bile being released through the ducts in the liver, and then ultimately they connect with the pancreatic enzymes that are also coming out through another duct, and everything meets up in the small intestine here. And if there is food that is present here that contains large amounts of fats and some other things will trigger it as well, then it will help to break it down. All right. So I want you to look closely at what's happening here though, because in this diagram, what we see is that within the liver itself, there are several tiny ducts or pipes, if you want to use the word pipes, and they start from very small pipes scattered throughout the liver, and slowly, like little branches of trees, you find that they empty into progressively larger pipes or ducts, starting from really small ones and then going to the really bigger ones, and ultimately into what we call the common bile duct. And over here we have the gallbladder that is supposed to help to concentrate extra bile and also to store extra bile so that there can be adequate amounts for release, either for getting rid of toxins or for digestion of food. But the tricky thing with all of this is that over time, some of the toxins that are passing through these pipes, and these toxins can be actual waste products, they can also be partially broken down medications, they can be partially broken down debris from infections, all viruses, fungi, parasites, you name it. They can even be partially broken down hormones, they can be partially broken down chemicals, all of them passing through tiny pipes and onto bigger pipes. But eventually what happens over the years is that along these pipes you accumulate a little bit of sludge. And you can understand why. If you constantly have this bile with all the different stuff that it's trying to carry out, passing through these pipes, over time, what's going to happen is that some of it is going to accumulate on the walls. If it doesn't flow through as freely as it should, some of it, just a small amount, gets stuck on the walls. And within that sludge on the walls is also the contents that the body was trying to get rid of in the first place. Now, here's a tricky thing about how this whole system works, right? Is that here we have a diagram of the liver here. You can see the gallbladder being shown, the gallbladder and all of the emptying going this way, going along here and emptying out here. Next week, we're going to discuss how the pancreatic duct also empties somewhere along here, and the two of them kind of empty into the same place in the small intestine. But would you believe that one of the tricky things about bile is that after it has done its work here and has been digested or has assisted with digestion, a lot of it actually recirculates and gets back into the pipes, the biliary system, the bile system of the liver. And so a lot of it actually recirculates instead of being cleared all the way out into the toilet. Sometimes what happens is just the toxins are cleared and the bile is reused. So what we have then, let's go back a little bit, is a setup that's very similar to when you don't change your car engine oil at all. Just imagine driving your car without ever changing the oil. I don't want to be accused of mansplaining, but let's just assume that that's going to be a bad idea. And similarly, with the liver and gallbladder, what we really want to happen is that over time, we want a lot of this bile, instead of being recycled for reuse, we want it to be passed out along these along the intestines and out into the toilet. We don't want to keep using the same bile over and over, because remember, when that bile is circulating back into the liver, that means it's going to have to start back from scratch, and it's going to pass through these same pipes that we know had sludge on them, which means every single time we release bile for whatever purpose, we are actually recontaminating that same bile, which is not what you would want to happen. So what that sounds like to me then is that we need to figure out a way to clear some of the excess bile and encourage the gallbladder and liver to make a fresh amount or release a fresh amount into the system, so that we have some nice, clean, pure bile for use. And yes, it may still get recirculated over time, but we want to be in a very, I'm going to predict where I'm going at this. We want to flush the system. In addition to that, we would love if some of the sludge that was on the walls, we would love to be able to flush that out under pressure and get all of it out into the bowels, and ultimately we want it to go all the way out and into the toilet. So we don't necessarily want all of it to recirculate and get back into the liver for reuse. We're hoping that every now and then we can just get rid of a batch of it, send it along out into the toilet, and with that we'll have a fresh amount being used for digestion of food as well as for transport of toxins. Now, in our very polluted world, the likelihood is that if you're watching this podcast, it's very likely that you have not had your gallbladder and liver flushed, maybe ever. Interestingly enough, for those of you who grew up in Jamaica and in a certain era, you will remember that at the end of summer, grandmother or mom used to give you something that we call a washout. Now, a washout, interestingly enough, part of the benefit of doing a washout was that it would force a lot of the old bile, because remember now, most of the time it was done with castor oil, an oily substance which tends to stimulate the gallbladder to respond. And so you would have a fresh amount of bile being squirted out, a good amount being squirted out. And then what tended to happen is that the castor oil would push everything all the way out and into the toilet. And so for those of you who didn't think that that was a good idea at the time because it tasted horrible, just know that a lot of the work that I do with the Gerson therapy in particular, and so many other protocols, nowadays they will consist of something that helps to flush the liver and gallbladder and to get some of that excess bile and excess toxins out into the toilet. Let's take a quick break, and then I'll be right back to tell you a little bit more about what we're trying to achieve here with what is known as gallbladder flush.
In a world that moves too fast, it's easy to lose touch with what truly matters, your well-being. At Teshuva Wellness, we believe in a return to balance, to healing, to your best self. Our holistic approaches nurture not just your body, but also your soul. Whether you're seeking peace, energy, or a deeper connection, we're here to guide you every step of the way. Our medical experts specialize in holistic treatments for chronic diseases, ranging from autoimmune illnesses to cancer. Our treatments are safe, non-toxic, and effective. Because at Teshuva Wellness, your journey to wellness is our greatest commitment. Visit our website today at teshuvawellnessja.com or call 1-876-787-8197. That's 1-876-787-8197. Teshuva Wellness. Return to health. Return to your best self.
Okay, and so we're back. A lot of information to digest, no pun intended, all at once, but that's okay. We can handle it. So we're going back over to this diagram here. And what we're finding is we want to get a nice way of getting this gallbladder to respond very forcefully to something in order to get a good amount of the bile in the system out under high pressure, and then we'll hopefully get it propelled all the way out and into the toilet. Now, with that is gonna go all the sludge that had accumulated along those pipes. And so we're gonna have all the chemicals that you've been exposed to, medications, occupational hazards. One of the big ones that I see is pesticides. A lot of these pesticides get stuck in the biliary tree or the bile system, not quite able to come out, and the liver is sometimes also having difficulty packaging them. So if we can get rid of a lot of these things, chemicals, pesticides, old medications, old pollution that you've been exposed to, old infection and inflammation from years gone by that was never really properly cleared. And of course, for the ladies in particular, old hormones that were not properly broken down. A lot of these things, when cleared, they'll now create room for the body to be able to function better. With a fresh amount of bile flowing through a nice clean system, what tends to happen is that you have better breakdown of hormones in particular. And of course, that's going to help you with your weight loss ultimately. So the tricky thing is we need to figure out a way to stimulate the system to react. Now, there are two things that generally will cause the gallbladder to react forcefully. One is something that's very sour, and two is something that's very fatty. And so I'm straddling the balance here, but our gallbladder flush, just being very cautious. I don't want to give specific recommendations here, but generally speaking, a gallbladder or liver flush consists of a way of getting that gallbladder to forcefully squeeze out a good amount of bile through the system in response to what it perceives to be a good amount of something sour or something very fatty. So in the gallbladder is thinking, there's a large fatty or sour meal coming down, acidic meal coming down. I need to help to neutralize this with some good old bile. And in so doing, it responds very forcefully by pushing a good amount of bile through the system, almost like a pressure wash. So you know when you have your kitchen sink and the sludge has accumulated on the inside, and you need to get something there to dissolve it and break it down, you can use, I'm not going to use any brand names, you can use chemicals to pour and try to dissolve it, or there's sometimes ways to relieve the pressure or increase the pressure to try and force the sludge out. And that's exactly what happens in a gallbladder flush. What the patients usually report afterwards is that the next morning, they usually do it at night, the next morning they usually see very small, tiny little, I'll use the word pellets, usually greenish or blackish, tiny soft pieces of sludge falling out into the toilet. Now I want to make a quick distinction here. We are not in any way trying to treat gallstones. Gallstones, if you look at this diagram, gallstones usually occur when there is something happening within the gallbladder itself, and that causes buildup of, or kind of like hardening and buildup of different substances in the gallbladder, which then sometimes get stuck at the neck of the gallbladder when it's trying to squeeze out some bile, and that can cause quite a bit of problems, as many of you know, because those are known as gallstones. And so a lot of people, when first faced with the need to do a gallbladder or liver flush, will say, hey, but I don't have any gallstones. Or somebody might, one of the popular things people will say to me is, I don't even have a gallbladder. My gallbladder was removed. So why do I even need to do this? And the point is that it's not necessarily just the gallbladder that we're trying to flush. What we really want to do is to get the entire system, remember this diagram here, we want to get the entire system of all these different pipes essentially pressure washed to get that bile out. Now, let's not beat around the bush. There are going to be beliefs that, okay, this thing is actually not really what it says. I've heard over the years, and I myself over the years have kind of wondered at first, I wonder if what's coming out here is just the same substances that we gave the person to drink, because usually it's a mixture of oil and something acidic, like a citrus-based substance. And usually what comes out looks, yellowish green and so on. And so many people over the years have proposed that, this thing really isn't doing anything. However, in my own experience, and you know me, I'm going to try it either on myself or in a patient who is willing. I have noticed that one, patients who have been exposed to significantly more occupational chemicals, like pesticides, as I mentioned in the previous episode, they have a lot of pellets coming out the next day, whereas other people may not have any pellets at all. So if it were simply just what we were giving to them to drink, you'd expect that everybody would have seen the same thing coming out the other end. You would not have seen that disproportion between those who really needed it and those who maybe didn't need it as much. The second thing I've noticed is, especially in women, when we examine these women using something called a vital reflex scan, when we examine them and we find that the gallbladder needs support, we recommend the flush. What tends to happen is after a few cycles of the flush, or sometimes even after just one cycle, we find that these women immediately start to change their metabolism. That's one. Two is that with that change in metabolism, meaning the type of foods that they desire, how often they eat, automatically comes significant weight loss. And I don't like to venture too much into this area because weight loss is tricky. Some women actually don't want to lose weight, so I like to use the word weight management. So with the bile being cleaner, with all of those old sludge that accumulated on the inside of these pipes being removed, what tends to happen is that it's easier for the body to clean itself, to break down old hormones, break down new hormones in the right way, and regulate itself well. And so weight loss or better weight management and metabolism is usually the outcome. And of course, for patients who have cancer or other chronic diseases, again, you can never get away from necessity of detox for treating cancer in particular, chronic diseases in general. And so I advocate quite a bit for gallbladder flush in a lot of my patients. Yeah, so stories. Well, here's a story. I recently, over the past 2 years, I met a young lady who had sickle cell SC. And for those of you who are really brilliant healthy reasoners, you'll know that sickle cell SC causes challenges with gallstones quite a bit. So this young lady came to see me because she had had multiple episodes of what we call cholecystitis, meaning the gallstones causing problems and pain and so on. And she really wanted to get some relief. In each case, what usually happens is we as doctors try not to do surgery right away. And so she had been, sent home to settle with the promise of surgery when she was more stable. But she actually was quite reluctant to do the surgery. So we arranged for her to do a gallbladder flush. And she had an ultrasound done before the flush, which clearly showed gallstones within the gallbladder. So looking at this diagram again, they would have been accumulating within the gallbladder itself and somewhere right here. And so we arranged for her to do the gallbladder flush. She did it and went back to do a repeat ultrasound a few days after. All the gallstones had completely disappeared. So, of course, the person doing the ultrasound for her, the imaging, was quite shocked because they had just seen her a few days before or weeks before, and now they're seeing with absolutely no gallstones. And of course, since that time, her overall metabolism has improved so much. She has actually gained weight. That's why I was very careful earlier about speaking about weight loss only, because in her case, as you may know, patients with sickle cell disease are often quite slim, and she wanted to gain weight. And so with better metabolism and balancing of her hormones, she actually was able to gain weight. Another story I could tell is of a gentleman I met who had prostate cancer. Remember, we spoke about that last episode. And he had grown up in an area off my island, Jamaica, where there's lots of bauxite mining taking place, as well as agriculture in the same space. And so the soil that he was using for agriculture was quite near to the soil being used for mining. And it is my belief that the two things caused a perfect storm within his body. So by the time I saw him at age 40, he had left that area, but then gone on to work in a factory that manufactured batteries, car batteries. So again, you could see the constant exposure to heavy metals that would have played a significant part in his clinical course or his journey. We had him do the gallbladder flush, and he called me the next day to say that he had seen over 200 tiny pellets in the toilet the next day. And of course, his overall health began to improve with time. So I wanted to talk about the gallbladder flush today because I find that it is such a pivotal part of helping patients to get back into balance in general. And when that block exists, you can just imagine. Here's a good way to imagine it. Here's another story. A young lady recently, I've been at Teshuva Wellness, we've been doing a weight loss challenge. And a young lady came to see me who said, listen, doc, I've done everything I'm supposed to do. I exercise avidly. She gave me a diet plan that she follows very strictly. She doesn't eat animal protein. I mean, she was doing everything perfectly. And yet when I examined her using the vital reflex scan, of course, we found that there was a limitation or a block at the level of the gallbladder. With that block, you can imagine you're putting all of this healthy food, all this healthy nutrition into the body, but yet, as we know, there is no opportunity for good detox to take place. And so her gallbladder system or her biliary system probably has a lot of sludge on the inside from over the years of being exposed to other things, which we can't avoid as humans. And so the first step for her is gonna have to be to do a series of gallbladder flushes so that we can help her body to better utilize the nutrients. And I hope to be able to give you an update on her in a few episodes. So I wanted to ensure that we spoke about the gallbladder flush this episode, and I'll tell you why. I want you to look back at this diagram here. And for those of you who are great healthy reasoners, I'm going to leave you with this little hint about what we're discussing in our next episode. It has to do with one of my favorite cancers to treat. And I know that sounds weird, but it's true. I enjoy treating this type of cancer for two reasons. One, the expectations that people have when they develop this type of cancer are that they will not be around much longer. And so I find that patients are usually either very willing to do something, or they're saying, listen, I can't be bothered. So right off the bat, I know that this patient is going to be very decisive. And that's what I like, decisive patients. If you're listening and you ever become one of my patients, one way to get in my good books is to be decisive. I respect your decision either way, but we need to make a decision quickly. And with this particular type of cancer, the patients are very decisive. The second thing that I love about it is that because it is so close to the function and action of the gallbladder and liver, if we can get those two organs to perform better, then this organ here, you see it has a tail and a head, functions a lot better as well. So I'm going to leave you with that one. By the time we get back together in a week, you should be able to tell me what that organ is. As a matter of fact, if you're watching this on YouTube, leave it in the comments below and tell me if you can guess what we're going to be discussing next week. If you're watching on Spotify, which you can do now, I want you to guess as well. And if you're not even seeing it, but you're listening on another podcast platform, I welcome your comments, please, or send your messages to 1-876-405-7831. I've been getting some good comments and messages, and I'm happy to respond to them. I look forward to seeing you guys again next week, right here on the Healthy Reasonings podcast, your number one podcast for clear, unfiltered information about your health and wellness. See you soon.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice note on WhatsApp or a WhatsApp message. The WhatsApp number is 1-876-405-7831. For more information or to become a sponsor, please email wellnessdocjamaica@gmail.com. See you soon.